All right. Let's get this show on the road, shall we? All right. So, first off, I want to welcome you guys here. I know you could have been any place in the world this evening, especially not being in Atlanta traffic. So, I want to let you know I appreciate that. Hopefully, you can leave this office tonight with hope, some answers, and some help. Okay. Um, Hope without actions are nothing but dreams, though. So okay, so that's why we want to give you some action steps as well. um, the conversation that we're going to have this evening is born out of the conversations that I've had with parents, that I've had with school teachers, that I've had with occupational therapists, speech therapists, the folks that are to having to deal with the children that are on the spectrum that are having these sensory processing disorders. And it's frustrating. It's frustrating for the parents, it's frustrating for the workers, and it's frustrating for the children as well. Um, this is a very important thing to me, as far as what I'm passionate about. And a little bit later, you'll understand a little bit more why it's more important. Um, First thing, we're not here to judge anybody. We're not here to judge the professionals. We're not here to judge the parents. We're not here to judge the kids. We're here to talk about the sequencing of events and what has led to it. Okay. Um, if you're like most parents, and I'm assuming you guys have, or do you have someone in your family or? Okay, okay. So yeah, so you've more than likely been everywhere. Okay, you've probably tried all the different types of professionals and all the different types of things that we do. What we do here is we are a neurologically based chiropractic office and wellness center. Okay, and so what it does is it centers us more on what the cause of everything is going on and what we can do that's different from the other things. So if you have any questions, I hate the sound of my voice. Okay. So I would appreciate it if every now and again you just interrupt me and ask me a question. You don't have to, but I mean, and if you don't, this will go by a little bit quicker. But I promise I'm not going to keep you out all night. Okay. All right. So um, as parents, you have basically three options for the care of your child. Okay. You have the traditional medical doctors. I know a lot of folks think that chiropractors are going to bash, medical doctors. Just like sometimes medical doctors bash chiropractors. We're not going to do that. This is a cooperative effort. Okay. Medical doctors are doing the best that they can with what they're given. A lot of times when the only tool that you have is a hammer, everything looks like a nail. All right. Um, and we'll talk about a little bit more in depth on what we see and what they might be missing. But the traditional medical route is to give drugs, to give, for everything that's going on. It's there's a pill for it. There's a potion and everything for it. A lot of times what they end up doing is they're treating the symptoms. Okay. You're not going to ever be healthy if you're just treating the symptoms. Okay. The new wave is functional medicine, the integrative medicine, the doTERRA, the holistic types of things, the vitamins, the supplements, and everything, which again works hand in hand with everything else. There's no necessarily wrong answer to what you're doing. There's just more right answers, if that makes any sense. Okay. And then there's us, neurologically based chiropractors. And I want to make sure that I emphasize that we are neurologically based because you're not going to see a lot of patients in here from car accidents. Okay. You're not going to see any patients in here from workers' comp that have had a slip and fall at work and things like that. Not that we don't care about them, not that we don't want to take care of them, but what we do at this office is a little bit harder to describe. Okay. It's why we have these forums and these workshops, because it takes time for me to explain to you what we're doing, how it's going to affect your body. It's a lot easier than back hurt, me fix type thing. Okay. I am not a pop and pray chiropractor. Okay. What we do is it's very much scientific based. It's very much the neurology, and we're looking at how your body works and what's going on with your body. Okay. But before we talk about any of this other stuff, we're going to talk about uh, a lot of times we call it the moonwalking bear. Have you ever seen this before? Okay. I want you to pay attention because this is pretty cool. All right. Let me make sure. Hold on. Let me make sure I have the volume turned up so you can hear this. Not very good for the camera, but there you go. Hold on. All right. Let's see.
This is an awareness test. How many passes does the team in white make?
Pay attention.
The answer?
How many did you get? How many did you get?
I counted 11 at least.
11?
I feel like the answer was something else when I saw something like this.
Okay.
But
All
I'll
right.
say 11.
Okay. Hold on. Hold on. Gonna
I
do.
lost track.
Yeah.
This is an awareness test.
Okay. Cool. Count them one more time.
How many passes does the team in white?
Just the one in white. He's like, I'm just gonna focus on that white.
Oh, 12.
The answer is 13.
Ah.
But did you see the moonwalking bear?
No. No.
So watch it again.
I didn't know that's what it was.
Yeah. So right there, just as plain as day, he's getting it down. He probably could have won the breakdancing competition if they'd have been from Australia. Okay. And that's the whole point of it all. It's easy to miss things if you're not looking for them. Okay. And that's why we call it the moonwalking bear. And so we're doing that a lot with these sensory processing disorders. And when I say sensory processing disorders, I'm talking about the apraxia, the autism, the ADHD, all of those things are all sensory processing disorders. And there's the moonwalking bear. As we're trying to treat the symptoms, there's a moonwalking bear, in my belief, that chiropractic has found that we're going to talk about. Okay. So we labeled this this workshop the perfect storm. Have you ever seen the movie The Perfect Storm? Okay. So it's like a convergence. It's been a long time. It's been a long time. But it's like a convergence of two things that shouldn't be all that bad, but they make one historically bad thing. All right. So the first thing the first thing in the perfect storm is significant mental and emotional stress during the prenatal period. Okay. How many kids do you have? Two. Your first child, I'm assuming if you're like most women, that your friends they threw your baby shower and they gave you a book. Did you get the book?
I got a book.
What?
Like your family.
It was COVID.
Okay, yeah. So that's a little different. Usually, you get a book. The women get a book. What to expect when you're pregnant? What to expect from your
I got a way childhood book from
yeah.
your family.
So, but most expecting moms get those, and it is the scariest book. It's like all the bad things that can happen, and you got to expect this and expect that, and then you talk to your family and your friends, and it's like, oh, our pregnancy was so bad and it hurt and all this stuff, and so you're already like scared. Okay, you're already, and I say that what to expect when you're expecting. I always say that it was written by Stephen King because it's like a horror book, right? But the thing about it is that stress that you're feeling, the fear, the anxiety, the stress, and that's just if you have a supportive partner. Like you can have a poor partner who's, you're arguing all the time, or there's the stress of working and all that other kind of stuff. All that stress comes from you and is delivered to that baby via the umbilical cord, because not only are you going to have, it's the umbilical cord going to be giving your child nutrients and oxygen and everything, and normal abdominal flora and things like that, but it's also conveying some of your stress too. And so as the nervous system is developing, what ends up happening is you get that stress, and now instead of that baby maturing, that baby's in protection mode because of the stress. Okay, that's the autonomic nervous system kicking in that we'll talk about here in a little while. Okay, so that's that. So that's the first part of the perfect storm. Second part is medical intervention and then label deliveries. Okay, so when we talk about the significant mental and emotional stress, what we see is we see that in probably 50% when we're doing the case studies and when we're doing when I'm intaking the patient. We ask these questions, and so about 50% of the patients have the stress during the pregnancy. Another 85% have medical intervention, and we're talking about forceps, vacuum delivery, cesarean section, and again, not judging, okay, because a lot of the times these are necessary, but there are 33% of women that have cesarean sections, whether they're necessary or not. Okay, that's a lot of stress on that child. That's his first introduction to the world is a cesarean section with vacuum forceps or tongs or that kind of thing. Okay, so that can set up part of the perfect storm. Okay, so you end up with a stressed colicky baby, a baby that won't latch. Okay, that can't turn his head. It's not eating right. It's not pooping right. Okay, and it's not sleeping well. And what a lot of the OB/GYNs will say is maybe they'll grow out of it. You don't grow out of stuff like that. What you do is you go from a stressed colicky baby. Constipation is 4 times more common in children with autism because of the gut and the brain gut diagram and things like that. So you grow into a child it's a sensory child that's constantly sick and challenged toddler. Antibiotics. Okay, folks are with ear infections, they're still prescribing kids antibiotics when 20-30 years ago they've told you that they're not effective for ear infections. Okay, but they keep prescribing them because, like I said, when when the only tool that you have is a hammer, everything looks like a nail. And again, not bashing the medical community. What I'm doing is I'm not against drug use. I'm against drug abuse. And a lot of times in our society, especially in this country, we use medication way, way, way too much. Okay. Again,
When you say it doesn't work, are you saying like it won't get rid of it?
yes, because a lot of the times it's the ear infections are viral. So you're doing antibiotics, which is bacterial, and so no, it's not gonna get rid of it. And so what you're doing is you're introducing more toxins into. At that point, it's a toxin. Okay, because if it's not to help the body, you're introducing something that's foreign to the body, and it ends up being a problem for the child. Okay, so again, you grow into a challenged toddler, and then you come into a hyperactive, emotionally stuck child. The ADHD, the fidgety stuff, the things like that, they're unable to concentrate. It's like I said, the perfect storm. It just keeps going and going and cascading. And now you've got an exhausted, angry, and anxious, depressed teenager. So what do? You put them on antidepressants. Okay. Now, there are literally warning labels. Well, not warning labels, but the doctors are warned before you put a teenager on antidepressants, make sure that you know that there's a high rate of suicidality with those antidepressants. Okay. That's not good. That's not something we want to continue to do. And again, it can all trace back to back here. Again, it's that perfect storm. So now we've got exhausted, angry, anxious, and depressed teenagers. And then now it's burnt out, stressed, anxious, and attention deficit adults. Okay. Those we don't we don't grow out of that stuff. Like I said, we just grow into bigger and bigger problems. And so that's one of the things that we want to kind of try to avoid, right? So this chart, if you look on the inside of your sheet, okay, this chart is one of our most important things that we use in this office. It's a gas versus brake pedal, and we'll explain that a little bit more. The main things we want to look at are the 3 things underneath the tachometer, the 3 T's: traumas, toxins, thoughts. Okay, those are the 3 types of stresses that can overwhelm your body and send it into a sympathetic or a fight or flight phenomenon, right?
Very sympathetic, calms down.
Exactly. So trauma. You think of trauma. The first trauma that we have is that birthing process. The birthing process where you're pulling and tugging and twisting the spine that has not been formed yet. The muscles haven't been formed yet. Okay, and you're already introducing a stress into that child before they've had their first meal. Okay, the toxins, like we just talked about, with if you're introducing, and I'm not going to bash vaccines because I've had them, but people do have bad reactions to vaccines, just like they have bad reactions to other kinds of medications. So if you're just throwing these medications at the child all willy-nilly, again, they become toxins. That's another stress on the body. Thoughts, uh, the emotional stress that we talked about from the mother, those thoughts, that panic, that when you're depressed or you're anxious or whatever, it goes into that child via that umbilical cord. And again, it sets up that perfect storm. And that, bless you, and that stress gets stuck on their nervous system. Okay. And it's not something that just wipes off, it's stuck there. You have to physically take it off via the way, via the adjustments. Okay. So, the nervous system, again, neurologically based chiropractor. The function of the nervous system, this is by Dr. Bruce Lipton, who is a stem cell biologist. The function of the nervous system is to perceive the environment and coordinate the behavior of all other cells. Okay. That word behavior. Okay. A lot of you guys are here because of behavior. Not maybe it might not be the behavior of the child as far as how they act, but we're talking about the behavior of the gut. We're talking about the behavior of the immune system. We're talking about the behavior of the lymphatics and things like that. All of those behaviors are influenced by the way your nervous system perceives the environment. Okay, think about it like this: you get a phone call, you're lost, you're going to go visit your friend in LaGrange. You got no signal, you got really bad signal. All right, you call them and it's breaking up. All right, you're not going to get where you're supposed to get because it's a bad input. So if the input is bad, if I'm perceiving everything coming towards me bad, friend or foe, then the way I'm going to act towards you is going to be influenced by how my perception is. So if you have a nervous system that's not working like it's supposed to, and it's perceiving things wrong, then the output, the way your body reacts, to what your body gives back to the environment is going to be wrong. And we see that with kids when they're having problems like speaking, right? The input that they're getting is jumbled up and garbled. So there's no way what they put out to the world is going to be wrong. Is going to be right, be viewed correctly. We call that not being able to perceive your environment. We call that a subluxation, and we'll talk about that in a second too. But just kind of hold on to that. Okay. So the signs of subluxation or the altered perception in your child. Okay. The first thing is a traumatic birth. And I'm going to hammer that. Because that's usually the place of the first subluxations in your child. They're at their most vulnerable, and it's a lot of stress on their nervous system and on their spine. All right. The second thing is the plagiocephaly or the asymmetry. Plagiocephaly means your head's misshapen. You know, I don't have children, but my mom said that my head was warped when I came out, and so she would have to massage and everything. And the reason that it's warped is because it's bad positioning while you're in the womb. Okay, your head down, and if your neck is twisted one way and it's going to misshape your head. But again, that's still pressure on that nervous system, pressure on your spine. So the asymmetry, difficulty nursing and torticollis. Again, your head's misshapen, your neck's out of place. You've been, for the last 3 months, you've been stuck in this place, wrong side up, and then there's pressure on that neck. And now when you get out, your head's tilted and you can barely turn your head. So one of the questions that we ask parents first off is, does your child latch to both breasts equally? And usually they don't, because there is a problem moving. There's a problem with the kinetics, with the movement of the spine, because it's been stuck in that place for so long, right? All right. And so that's one of the things that we can say, all right, that looks like it could be a cause of a subluxation or the altered perception that sets up the perfect storm. All right. Ear infections, reflux, colic, constipation. A healthy nervous system with a child does 3 things. That's it. That's all you have to worry about. If your child is eating, sleeping, pooping, If they're doing that, their nervous system is pretty doggone healthy. Okay. But you can also tell that there's a big time correlation for kids with sensory processing disorders that they don't eat well. They definitely don't sleep well. And there's a lot of constipation with them as well. Okay. So again, that's another way we can look and see if there might be a subluxation in your child. Sitting and crawling challenges. Okay. Crawling is a pretty coordinated movement. Okay. It's not just, we take it for granted because, that's what we do, but that's a coordinated movement. If your body is not able to perceive motion like it's supposed to, it's not going to be able to coordinate. It's not going to be able to, it's going to not have the balance that it needs, and it's not going to have the coordination that it needs. And again, that could be a sign or symptom of a subluxation. Spasms and hypertonicity. Babies that do a lot of arching, they don't calm, and they're always arched, and they never calm down to just lay flat. That's just their body in that sympathetic response, that fight or flight response. Okay, poor balance and coordination goes back to the sitting and crawling challenges. Okay. Hierarchy of neurological challenges. We're going to skip that because I know you guys don't want to be here all evening. But the interaction of genes and experience and genetic and experience shape the developing brain. Your brain develops from the back to the front. Okay, and so what you're doing as it's developing these neurons, and the neurons start the coordination, especially in the back. That's your coordination, your breathing centers, and things like that. And so you need to make sure that we're not having issues with that kind of development. Cognitive, emotional, and social capacities are inextricably intertwined through the course of life. Toxic stress weakens the architecture of the developing brain, which can lead to lifelong problems in learning behavior, physical and mental. Okay.
Wait, go back. No, I was too bad.
I'm sorry.
That's it.
But again, that's one of those 3 T's: traumas, thoughts, toxins. Okay. Think about it like this. All right. So we've got in the development of a child. Okay. The first sensory thing that we do is we get sensory pathways. That's the learning, the vision, and the hearing. If this is messed up right here, if the hearing's messed up, if the afferent, what's coming into them, is jumbled and perceived wrong, then it's going to set all of this other stuff up poorly. Okay, it's going to set the language up poorly, and it's going to get the higher cognitive functioning set up poorly as well. So the algorithm for the perfect storm is how much stress, okay, when did the stress occur, okay, and then that's going to let me know from my standpoint what kind of care, how long the care, and that kind of thing. All right. So I'm going to show you this. This is probably my least favorite slide on here, but it's something that you guys need to see because this is the moonwalking bear. Okay. So just take a look. If a picture's worth 1,000 words, and this video is worth War and Peace. All right. So this is just a normal cesarean section.
Come on, buddy. Ears of a girl. Ears of a girl. Make you cute for the camera. Oh, yeah. She's coming back and just
Yeah. Yeah. And so yeah, that right there, that's the moonwalking bear. All right. And again, I'm not here to bash anybody because a cesarean section can save lives. The C-sections can save lives. And so they're very necessary. My problem is, and if you listen to them, they're just completely nonchalant. They're whistling, making jokes and everything. Listen, I don't like my pilots to make jokes on a plane. I want you to be serious. Like this is very serious. And so they do this so often that they're nonchalant. The problem comes because literally when they're done with that baby, they wash their hands of it. They don't have to see that child again. Right? Now, if those same doctors had to deal with those children till they were 1 year old, 2 years old, 3 years old, and they're looking at kids that aren't eating well, aren't sleeping well, they're not having good digestive functions, okay, they would start to think like, I wonder what's going on. I wonder why this is happening. And they would start looking at maybe it's a process that that starts here, just as a curious mind. Because think about it. You give someone your child, your newborn. What's the first thing you say to them? Watch the neck. Hold the head.
Oh,
Yeah, hold
I was just gonna say,
be careful. Yeah, but yeah,
yeah.
hold the neck. And what do? Like they twist and pull and twist and pull, and that is a hell of a stress on that spine. We're going to talk about the vagus nerve. So the vagus nerve. Have you guys heard of the vagus nerve? Yeah. Yeah. So it's not Vegas like the city. But the vagus nerve is right in proximity with that. The vagus nerve is absolutely of utmost importance in getting hyperactive children, getting children that are in sympathetic dominant states to calm down. And we've already put stress on it before the child's had his first cheeseburger. Okay. And so that's what one of the things that we have to understand is this isn't they're not having necessarily a reaction to the gluten. Okay. They're just not able to process the gluten because there's so much of a stress on their nervous system. Am I making any sense?
Could you repeat the last part? I feel like I didn't hear the beginning.
What part?
You said that because you were talking about gluten, and I was
I said so.
Wait, how did we get on gluten?
No. So what I'm saying, it could be
Sorry.
gluten, it could be peanuts, it could be all these allergies. It's not necessarily that. Why am
talking about like introducing food
because your body is because your nervous system is so stressed out that it's not processing it. There's like, so if my wife, for example, she has pollen allergies. I don't have pollen allergies. Like, it's because my body processes it different than her body processes it. And it's not necessarily that, I was born with a pollen gene that keeps me away from it. It's just that my nervous system works different from hers. And so a lot of times when you're treating these food allergies, you're like, okay, well, just get rid of the gluten or just get rid of the peanuts and all that stuff. You're treating the symptoms. And when you're treating the symptoms, you're never truly going to be healthy. I use this example all the time, just with healthcare itself. You get a fever, okay? Get 101-degree fever. What's the first thing you do?
Yeah, it's always Tylenol.
Okay, and why do you do that?
Because it's a fever reducer.
Exactly.
But yeah, it treats.
Exactly, you're treating the symptom. The worst part about it, though, is that your body gives you that fever because it's raised your core temperature to make it an uncomfortable environment for the virus or the bacteria or whatever. You go take that Tylenol, that aspirin or whatever, to lower the temperature. So what are you doing? Masking the symptoms, keeping yourself sicker longer because you're going counterproductive to what the body's trying to do. You're never going to be healthy treating symptoms. If there's one thing that I hope there's 2 or 3 things that you leave here with, but that's one of the things I would like you to think about. You're never going to be healthy treating symptoms, okay? And watch out for moonwalking bears, all right? Cesarean sections, I checked this out. It has stayed pretty stable at 33% up till the latest at 2022. So on the back of the folder, we've got basically a neurology chart, right? And so what we're looking at, what we're going to start going into now is the neurology of what we're doing, okay? If you see at the very top, it says the vagus nerve. The vagus nerve is the primary component of the parasympathetic nervous system, okay? You see down at the very bottom, it says the parasympathetic plexus. That's the other part, the other center for the parasympathetic. Parasympathetic, what that does is that's the brake pedal, okay? There's the gas pedal, which is the sympathetic nervous system. So if you're driving down the road and a deer runs out in front of you, your heart rate goes up, your eyes, your pupils dilate, and you're just on 10. And then you calm down after you drive off a little while. Okay. So the reaction is your sympathetic nervous system, your fight or flight nervous system coming in. Your parasympathetic kicks in afterwards to bring you back. Okay. The problem with a lot of our sensory processing disorder kids is their vagus nerve, their parasympathetic system is not on the job. Okay. And so it's always at 10 and there's nothing to bring it back. All right. So if you look, the top, the vagus nerve, That's that injury that we had with the what you call it, with the birth. Okay. Down at the bottom, parasympathetic plexus. It looks good when we put the kids in those bumbo seats and they take the pictures and you put them in the baby borns. The kids are not supposed to be sitting up like that. They're not supposed to be weight bearing like that already. But we as parents do it because for convenience, for comfort, it looks good and everything like that. What you're doing is you're setting up problems with that parasympathetic plexus down at the lower part of your back. So we're adding to the perfect storm, right? So that, remember I talked about subluxation was the stress that's stuck on your nervous system. Now there are 10 Ds of subluxation. Okay, I can only pronounce about 8 of them. Okay, I'm only going to describe 5 of them because that's going to be the most important to what we're talking about with this perfect storm. So the first one, dyskinesis, right? Dyskinesis means movement, right? Dyskinesis means abnormal movement. That means that you're uncoordinated. All right. So you get the one of the first things that happens when you have those subluxation is there's not good movement. Okay. The child doesn't have good movement, or the adult doesn't have good movement. All right. Second D is disafferentation. Afferent is your sensory stuff, what's coming in. Efferent is out, afferent is in, right? So disafferentation means that the things that are coming in, you don't recognize them. You don't understand it. Remember how we were just talking about friend or foe and how we're perceiving their environment? That's one of the main things. We're getting abnormal sensory inputs. And when we get abnormal sensory inputs, our output's going to be poor, right? Dysautonomia. We're talking about the autonomic nervous system. Okay. The autonomic nervous system does 300 trillion processes a second. Okay. We are aware of 50. We are conscious of 50. I am aware of 5, if you let my wife tell it, especially if I have to go to the grocery store. I can't remember anything, right? So, but the point is, when your autonomic nervous system isn't working like it's supposed to, that's that central nervous system, that's the sympathetic versus parasympathetic, that's the checks and balances. Okay. And so that sets it completely off track, and you set it up for the sensory processing issues. Dyskinesis means energy, abnormal energy. Kids are bouncing off the walls. Okay. And I was one of those children. I'll talk about myself here in a second though. But I was one of those kids. So you're just like, man, I wish could you just sit down for just a little while? But they have all this energy, and it's just because they're not sleeping. They can't sleep because they're just completely on 10, which goes back to the dysautonomia, the sympathetic being sympathetic dominant, right? And then the disconnection, being disconnected to your environment, not understanding that the greatness of everything around us, because you feel that it's always something attacking you, and you're because of the abnormal perception of it all. So I think that this is the most important thing, because when you have a child that's disconnected from their environment, disconnected from their parents, disconnected from their loved ones, like that's just a miserable, just thinking about it, it's just a miserable way of existence. We've got some more references, and I can give you guys links to that. We talked about the dysautonomia. I'm going to try to get y'all out of here since I had y'all waiting for a second. The vagus nerve, the parasympathetic, the amygdala, seat of the emotions. So that's why they're emotional all the time. Hippocampus, factual learning, memory, including situational awareness. Again, dysautonomia is gonna affect that negatively. Prefrontal cortex plays a central role in cognitive functions, attention, inhibitions, and control, right? So again, you can't be in growth and protection at the same time. So you think about it, if from in the womb, okay, if the mom is going through a lot and going through a stressful pregnancy, now that child is in protection. You can't grow while being in protection at the same time, okay? And so when I say grow, that means develop, and not just develop like size-wise, just emotionally, physically, just all the kind of things that we're supposed to be doing. It's going to inhibit that growth. And that's by Dr. Bruce Lipton, the guy who said about what the nervous system does. So the vagus nerve, it's a hot topic now, right? So there was a study that they took 30 kids, okay, 10 with no sensory issues, 10 with mild sensory issues, and 10 with severe sensory issues in a classroom. They put them with heart rate variability monitors. You probably, if you've got an Apple Watch, you've probably seen them. So it's different than a heart rate monitor. Heart rate monitors just measure what your beats are. Heart rate variability measures how fast or slow you can increase your heart rate or slow it down. Like there's no one in here unless you're a Navy SEAL, and you look like you might have been a Navy SEAL. Okay, I was close. Okay, thank you for serving, by the way. There's no one in here that can increase their heart rate or lower their heart rate on demand. Okay, that's part of that autonomic nervous system that you're not necessarily in control of. So what they did is they took those 10 kids and they put heart rate variability monitors on them, right? And then they started giving them stimuli, loud noises, bright lights, basically put them in a classroom because with all the stress in a classroom, right? So they put them in there and watched the heart rate go up. Then they took the stimulus away, okay? The kids with the sensory processing disorders never came down. Because so what it's doing is it's basically measuring if your vagus nerve is on the job. Because if your vagus nerve is doing what it's supposed to, it'll let you go up. And it's like, okay, that's enough. The threat's gone. We don't have to worry about that. We're good. Okay. They never get that. The sensory processing kids never get that. And so they're always, again, stuck at 10. And so that's one of the things that we check here at this office. We have we do heart rate variability testing to let us know what's going on with the nervous system. Okay, is that making sense to everybody? Okay. All right, brain, gut, diaskesis. That's one of the words I'm not good a fan of. All right, so this is Evan. Evan was one of my first perfect storm patients before I even knew what, the science behind it and whatnot. His mother took this video. This is him, and if you notice, you can see a black eye, but I'll let you see what's going on.
Bye, Aunt Kristen. See you later. No. No? Did you have fun? Did you have fun? Yes? Yes? Do you love Aunt Kristen? Say yes. Yeah. What? Bye, Aunt Kristen. We'll see you later.
Okay, it's heartbreaking. Okay. A little bit of story about Evan. He was a traumatic birth. He had a cord wrap. He had to do a cesarean section. So he started off life struggling. Okay. When he was first born, within the first week, he was having seizures. Seizures left after the first week and a half, 2 weeks. They sent him home, but after the first couple of months, he wasn't verbal. First year, he wasn't verbal. And so this is where we end up with him at. What's going on is a little exacerbated because he's stuck in the car seat, and with a child like that, with a sensory child, they want to move and they want to fidget. And so by being confined, that's kind of turning them even more up. But if you look, these are his scans. Okay. This is what we call a surface EMG that shows muscle tension. And this is a thermography scan. Okay. What we look at is color of the lines, okay, and the length of the lines. White's normal, green's mild, blue's moderate, and red's severe. So where do we see red? Up here at the top, vagus nerve. Down here at the lower part, parasympathetic plexus, okay? And so it's easy when you're looking for it, it's easy to find what's going on, okay? So she brought him in. After about a month, We did a care plan with him, saw him for about a month, and this is what we have now.
What's that one? Goody. What is it? Goody. A dog.
Smiling, engaged.
Yep. What's that?
A truck.
Fast truck. What's that one? No, this one. What's this one?
I mean, just how much better do you think his parents' life is? How much better do you think his life is? Like to be able to connect, to be able to be trying to verbalize and have someone on the other end like, oh, I get it. Because that's got to be frustrating. Like it's got to be frustrating. When I try to say something to my wife and she can't hear me, I'm like, I'm trying to talk louder. You know, it's you want to be heard. You want to be able to communicate. And so that's a really significant part of a child's life and a child's development. And so that's what we were able to help with. So again, perfect storm. When you see these children, you're going to see problems up at the top and then problems at the bottom. Okay. What we use equipment, and we'll talk about the equipment in a second. We use 3 different types of equipment. We use surface EMG that's going to show muscle tension. Remember that dyskinesis, how we're talking about the excess energy? That's going to show the energy, and it's also going to show where the muscles are tense at. We use thermography. Thermography is going to show inflammation. Nerves that are irritated put off a lot of heat. So we're usually going to see the inflammation down here and up here. And then we use the heart rate variability. And the heart rate variability is really cool. I'll show you that in just a second. This is Jackson. Jackson came to us when he was, I guess this was probably about 6 years ago. But so Jackson was having eye tracking problems, wasn't nursing, wasn't doing any of the kind of stuff that he was supposed to do as a child. And as he got older, they gave him glasses, but he was still the child in the back of the class they couldn't, the teacher couldn't, didn't have the bandwidth to deal with. And he was stressed out when he came home, stressed the parents out and everything like that. So within a couple of months, mom and dad noticed some amazing changes with Jackson. His meltdowns were occurring less and less. The meltdown wouldn't ruin his whole day because that's the biggest thing. Like he would lose it, and then for the rest of the day, you're just waiting for it to happen again, and he's waiting for it to happen again. Mom and dad could calm him if he started getting upset. He was more receptive, focused in therapy. He was happy and smiling more than ever, and that right there, that's what it's all about. That's exactly what it's all about, to give a child their childhood back and to give a family their family back. So with sensory kids, we put it into 3 different types of 3 categories. There's the drunken bull, the raging bull, and the kind of a combination of both. The drunken bull are the kids that they're not ADHD, but they're more, it's kind of more of a depressed type of a look and a look of a feeling. They don't have a lot of core strength. They don't have a lot of balance, but they still have attention deficits. They're not able to focus like they're supposed to. Whereas the raging bull, that's the kids that you'll see on the spectrum and the ADHD kids. And I always say you'll never see like a chubby ADHD kid because they're just using so much energy all the time, and they're just ripped and they look like they're ready for a workout session or whatever. Usually in autism, what we see is a combination of both. You'll see the spasming, you'll see the attention deficit, but you'll also see the lack of coordination as well. So we can put them in different categories depending on what we see on the scans. This is the HRV, the heart rate variability test. This is what the scans will look like. To the left of this line is a sympathetic. To the right is a parasympathetic. So you can see that they are squarely sympathetic dominant. And over the adjustments, what we're trying to do is we want to get it to center, and we want to get it to where they're not using as much energy. We want them in that putting green. So after time, you go from here to here to here. And what ends up happening with the child is you can see the progress with how emotionally they develop, physically they develop, and things like that. Okay. These are my victories. Okay. And these are all kids that we've seen at this office. We've had, from Case over there, who's just the biggest bundle of joy, but he was challenging. He did not want to get adjusted when he first came in here. And so sometimes you have to meet them where they are. And from little Z and things like that, this is how we adjust. This is our passion. This is what we do in the office. Here's a testimonial from Ali and his parents. Let's see if we can.
We have the Nunez family with us. You guys started chiropractic care with your son, and now it's transitioned to the whole family. So just kind of tell us how everything's been, what your experience has been here at Dowell Family Wellness.
Well, the experience has been really good. Bringing our son here, we had a couple concerns as he's a little bit sensitive to getting treated in different places, but this is not our first chiropractic experience, but it is by far the best. So yeah, he has not only just the treatment, the care, the actual process that he's gone through, the progress that he's had has been great. And we're just so happy that we were able to come here and go through this journey.
We're grateful for you. What about you, sir?
Yeah, definitely. We've seen a lot of improvement in just like the overall mood and behavior. Since we started coming here, he's just a happier kid, more manageable at home, at school too. Eating good. He's eating a whole lot. And yeah, but it's been a great experience here. Dr. Rick is awesome. Staff is awesome. Teresa, and it's been just a wonderful experience so far.
Well, we appreciate both of you guys. We appreciate both of you. We appreciate Ali. And thank you guys for your testimony.
So Ali came. His mom's a doctor as well. And she did the research, and she called me and she grilled me. Like it was my day off. And I have the phones set to where when the phone rings, if I'm not here, it rings to my cell phone. And I had to pull over to talk to her because she had just questions upon questions upon questions, which I love, because you know what? If you have questions, if you're coming to stuff like this, then that means you're energized and you're invested in your child. And that's the kind of patients I want. Okay. But and she was skeptical too. But we got them in here and we started adjusting them. And before you know it, they were like, let me see what's going on. I've got this going on and I've got this going on. And mom had migraines and, all that kind of stuff. And so we were able to help with that. So definitely a family affair. This couple right here, I've been adjusting her basically, I guess, ostensibly since she was